Hello everyone. Today I am going to discuss some of the skin lesions in the newborn. So basically there are multiple common skin findings in the newborn categorized into some innocent or transient lesions and some are the serious problems. You can see in this image also. Now according to the skin color, we have to see the color of the baby either pink or having the some cyanosis over the body or having the yellow discoloration. In acrocyanosis, peripheral part of the extremities are cyanosed. So here in this image you can see both the palm and both the sole are cyanosed bluish in color, while the central part of the body, face, trunk and other part of the extremities are pink in color. Label as a acrocyanosis, normally present at the time of birth and also whenever there is a heat loss or during crying, and it becomes normal pink whenever we warm the baby. It is a transient vascular phenomena, benign condition. Central cyanosis always pathological. Here in this image you can see the perioral cyanosis and also the cyanosis of lips present. So if lips, tongue or central part of the body is also cyanosed, we label as a central cyanosis. So it can be due to the respiratory conditions, respiratory failure if present, or maybe due to cardiac conditions, or maybe patient is having the upper airway obstruction. So if the baby is having cyanosis even during the crying, it can be because of cardiac or respiratory disease. So whenever cyanosis worsen during the crying, we should think that it may be cardiac or respiratory. If baby is having cyanosis when the baby is calm, but it resolved during crying, then you have to think about choanal atresia, means obstruction is present at the level of nose. So bilateral choanal atresia or stenosis, or if the baby is having apnea, then also during crying cyanosis will be resolved. In newborn period, whenever baby is having yellow discoloration of skin, that means baby is having the neonatal jaundice. So here in this image you can see baby is having the deep yellow discoloration of the face, trunk, limbs and even palm sole also having yellow discoloration. So according to the Kramer's index, if palm sole also yellow discolored, that means total serum bilirubin will be more than 15 milligram per dl. So baby is having neonatal jaundice. Benign neonatal skin lesions. One is the erythema toxicum neonatorum or toxic erythema. It is a very common finding in neonate. It is a benign and self-limited transient condition present in 50 to 70% of the full-term newborn, and lesions appear around second day of life and resolve within first week of life and involve almost all part of the body, face, trunk, extremities except palm sole. So palm sole usually is spared. Now the characteristic of these lesions are, these are the papular lesions, 1 to 3 mm size papules present over the whole body, and color of these papular lesions are white or yellow. These are firm papule. It is surrounded by the erythematous base. So you can see all over the body papules surrounded by erythematous base, known as flea-beaten appearance. It is characteristic of erythema toxicum neonatorum. No treatment is required for this condition. It is self-limited. Another benign neonatal skin lesion is milia. So here in this image you can see the characteristic lesions present over the forehead. These are the firm white papules without any erythema present over the forehead. Similar lesions also present over the neck and the face area. So these are the benign subepidermal keratin cyst, white firm in color without any erythema. Most common site is nose and also over the face and forehead. Sometimes also present in the neck and chest area. Also resolve within first few weeks of life No treatment is required. It is a self-limited condition. Only precaution should be taken that overwarming can exaggerate the melia, and we should advise the parents that whenever there is a sweating, they should clean the skin area and keep the temperature of the baby to be normal. Here in this image you can see this is pigmented macular lesion over the trunk present here also. So these are the Mongolian spot, also known as dermal melanosis. These are the congenital pigmented birthmarks and most commonly present over the lumbosacral region. And these are bluish green to black in color. So here in this image you can see this is greenish black in color, and shape is oval or irregular shape can be there, and it also resolve by 1 to 2 years of age in most of the patients, but extrasacral and dark colored sometimes even persist into adulthood, so it is also the benign condition. Now some other serious neonatal skin problems. So in this image you can see newborn is having the pigmented lesion over the half of the face. It is black in color, and here you can see the margins are irregular and surface is nodular, and this pigmented lesion is known as congenital melanocytic nevus. It is either brown or black in color. If size of the lesion is small, then more likely to be brown in color. If size is large, then it become black in color. So if size is less than 1.5, we label as a small congenital melanocytic nevus. If it is between 1.5 to 20 centimeter, then label as a medium congenital melanocytic nevus. If more than 20 centimeter size, that means large or giant lesion. It is also present at birth or shortly after birth. And in this yearly examination for first 3 years of life is recommended, and reassessment for every 2 to 5 years. And if required, then surgical treatment can be done. At least baby should be 6 months old. So surgical and non-surgical options also there. So for cosmetic purpose, if it is present over the face, surgery can be done even at the age of 6 months. Now in this image you can see newborn is having the skin lesion over the forehead and over the eyelid. This is red purplish in color and having the nodular surface and irregular border. This is benign vascular tumor known as infantile hemangioma. It is the most common tumor of infancy, present in 5% newborn, and it can present at birth. Initially it is just like a telangiectasia, and slowly it grow in size, and by the age of 3 months it becomes just like a nodular skin lesion. 60% of infantile hemangioma spontaneously regress by 5 years of age, and 90% by the 9 years of age, except lip lesions which generally persist. So the treatment rarely required in such case because 60% will be regressed completely by the 5 years of age. So according to the site and according to the age, we have to explain the prognosis and advise a treatment. Now another serious neonatal skin problem is epidermolysis bullosa. Here in this image you can see the child is having the skin lesions, and this is dystrophic variety of epidermolysis bullosa, and this is junctional epidermolysis bullosa. It is a rare group of inherited mechanobullous disorder, and it is characterized by the extremely fragile skin. Newborn is having the extremely fragile skin and even the mucosa that blister following the minor trauma. So initially newborn will have the blister formation, and when it will rupture, then this raw skin will be visible. Severity can be range from mild localized disease to generalized devastating process. It is also known as butterfly babies because skin is very fragile. There are three major subtypes: epidermolysis bullosa simplex, junctional and dystrophic. And according to the biopsy report and according to the various clinical feature, we have to differentiate which type. I have already uploaded a video on junctional epidermolysis bullosa case, and I have already published a case report on this condition. Supportive care is the only treatment option for this, and prognosis is not good in this condition. Here in this image you can see the baby is having the bully formation at the site of friction. So this is new bully formation, and the other lesion healed by the supportive treatment. Now another serious neonatal skin problem is collodion babies. It is also the rare condition, congenital. In this you can see having over the whole body, over face, trunk and limbs, baby is having the white, yellow, shiny, tight membrane, parchment like membrane, taut membrane which cover the whole body, and also having the ectropion and eclabium, eversion of lips and eyes present. Most common types of skin disorder which present as a collodion baby at birth are the autosomal recessive congenital ichthyosis, including lamellar ichthyosis, non-bullous congenital ichthyosiform erythroderma, and very severe condition is Harlequin ichthyosis. All can present as a collodion babies. So this is the image of the newborn at the time of the birth, having the white taut-like membrane covering the whole body. Now this is the image at the age of 2 to 3 months, and this is the image of the same baby at the age of 1 year. So this condition, if it is mild, then baby can have the good prognosis. If it is severe, example Harlequin ichthyosis, then the prognosis is very bad. So here in this image you can see this is Harlequin ichthyosis. It is a lethal form of hereditary skin disorder, autosomal recessive, and at the time of birth, large, thick, scaly skin lesions are present with the multiple erythematous fissures present over the whole body, and also having the ectropion, eclabium, open wide mouth is present, hypoplastic flat nose, rudimentary ear appendages, hypoplastic fingers and toes, and anonychia and joint contracture. So this is characteristic of Harlequin ichthyosis. I have already uploaded a video about the details of this condition. Thank you so much. This is in brief about the some of the skin lesions in newborn.